Thanks, Purnima, and I would like to thank Dr. Amrish Darak for including me in this course and giving me a very interesting topic, which initially I found strange what to talk on this because I don't have an experience regarding corporate setup. However, the point is making it my cup of tea. So I started thinking in those terms that, what all are expected from in a corporate setup, what all are expected in an institutional setup. So I just thought of a few points, like, if you are in a corporate setup, what's the difference basically? You have targets, you have set targets which are time bound, that you have to, get this much of revenue generation you have to do. And that is what is definitely there in almost every corporate setup. You have to show the turnover of patients in that setup, that you are useful for that setup and there is a huge turnover because of you. Then you have to achieve patient satisfaction by two things. Patient is not satisfied just by attaining good visual acuity, but the patient has to be convinced that your visual acuity is good, and that is done by patient counseling. And of course, there is a lot of competition between each group of setup, so you can't afford to lose patients. Then I thought that I'm in an institution, and we also work. So I kept the same slides, and then I thought that in an institutional setup, do we have targets? Is it time bound? It's not related to revenue generation, but yes, in an institution, you do have certain targets and you do have to show turnover in order to have an impact on your junior colleagues as well as your peers. So that is very important. As far as patient satisfaction is concerned, nobody on earth, whether one is in an institution or in a corporate setup, wants his patient to be dissatisfied. So of course, we also need to satisfy a patient. There is no competition between groups, but there is still a competition between your peers. So I have seen in my own institution, nobody wants to lose his own patient. We don't have a personal interest, but still we want to work like that. So does it mean that the corporate setup and an institutional setup is the same? I don't think so. There are many differences. And the first and foremost difference is that you have to establish a setup. And for establishing setup, you need a lot of money, capital, you need trained personnels on whom you can rely. You need equipments, you need, for maintenance only, a lot of capital investment, a lot of capital is required. The second thing is that what I would agree what Dr. Rohit was telling, that if you don't have smile, how will you talk to the patient that this patient can be, you can have good achievement, good attainment of vision by LASIK if you have LASIK. The point is that you have to understand the need of the market. Need of the market means that you should talk to the patient. And currently, these days, everyone goes to the internet, looks for the options. What are the options? There are many advertisements that keep coming. So based on the need of the market, you have to invest in a corporate setup. So you have to do a survey. A lot of homework has to be done. And then only you get to know whether particular equipment is required or not. And of course, patient counseling, many reasons why you need a patient counseling. Because you have to understand the need of the patient, you have to understand the expectations of the patient. Once you have treated the patient, you have to explain to the patient that this is you have attained a very good outcome. So that gives you a real successful outcome and a real patient satisfaction. Then there are other things as well if you want to establish a corporate setup, like you have to work with the Indian Medical Council, with so many other things, like, if you want to do some study, you have to work with the DCGI. Then you have to have your own sterilization unit, which we are not bothered about. So there are many things in terms of establishment. And the other thing is that you must have heard about so many crops of endophthalmitis coming up, and the doctor got caught in that. So in a corporate setup, the liability goes directly to the doctor because if the owner of the setup says that everything is fine, but probably the doctor has done a mistake. And however, in a court of law, based on respondeat superior, this is a legislation, the person who is the final authority is considered to be responsible. So even that person also has a liability. This is not the case in an institutional setup, wherein there is a lot of immunity as far as the legislation, as far as the, having infection in a patient is concerned. There are various other factors. There's a lot of trust amongst the patient that in an institutional setup, they are not doing anything wrong, so probably it's just an accident. That is not the case if you have a corporate setup. So what are the basic principles of a corporate practice? First and foremost, you should have an impressive personality. Like, we have some of the speakers, Dr. Rohit, Dr. Anand, Dr. Samresh, they're all impressive personalities. So if you can impress upon the patient that you can deliver, then, your setup will work. Of course, with good communication skill, as I said. You will have to give time to the patient. That is something, and for the same reason, in most of the corporate setup, I was speaking to Ambrish, and he has a specific counselor in a new hospital. So most of the corporate setup, they have a separate counselor, because the doctor cannot give that much time. There are so many patients. So you have a separate counselor who knows about each and every surgery, and they gives a good chair time. And of course, there are many other things. You have to be confident in your plan. You should have a good team. That is very important. Say, for example, I was talking about the counselor. Now, if somebody with a low or moderate myopia comes to a hospital, and that hospital doesn't have a particular equipment about which the patient is talking, then the counselor, it's the counselor's responsibility to make the person understand that whatever equipment, whatever appliance they have, they can be effective. So that is important. What I personally feel that we should not, and what Dr. Anand was also telling, that we should not over-promise. Dr. Rohit was also mentioning that, because many times there's a tendency that if we have started a setup, we want to generate revenue, and we over-promise, so we should not do that. We should avoid demanding patients, and we should always explain to the patient that whatever we are doing is not the only thing that can be done. However, this is the best option that can be given to the patient. There are other options, and you can go for the other one, but this is the best one. And patient finally comes to you with the best option only, but you can't say that, no, this is the only thing. Then the patient, if he goes to somebody else and some other option is given and he gets satisfaction, then he will just, badmouth you, and many other patients will not come to you. That is very important. Team building is essential. Right now, we are having the instruction course. Amrish is not well, and we have a team. Purnima is here, so they have a team. So they are working not only here, but also in a hospital wherein, the main person or the main surgeon, if it's not there, then the team will work, and that will take the hospital, because it's the team that gets the benefit by the increasing name of the hospital. So the team has to work. So, and a good team is very essential in order to improve this thing. Sometimes you have shareholders as well, so the cost can also be shared. And then in that case, the pressure of investment is not much. So that's why group practice is coming up quite fast, coming up quite a lot in India and in other parts as well. So there are certain advantages of corporate practice. You develop a good rapport with the patient. You have a good monetary benefit. There is more projection. The reason is this, that, if you have an institutional practice, then the institution is more projected, or there's not much of effort done to project the institution. But in a corporate setup, there is definite effort done to project the corporate setup. So the doctor also gets a projection, the corporate setup also gets a projection. And there are, like, we working at RP Center, we have almost most of the equipments that we have. But we have to work for it from very early phase in order to get the clearance, and there are so many other issues, so that, to attain that equipment. But in a corporate setup, you have to take a call and you can call the company people and you can immediately decide. So that is the advantage in a corporate setup. There are certain disadvantages that, the image is like commercial. People think that, they are commercial and they will, not give the right advice. That is a little bit of feeling that is there in people's mind. There's lesser trust, and there is, of course, setup difficulties, and there's a difficulty in investment in research, because in a corporate setup, you always see whether it has a cost benefit or not, and that is very important. So that is there is one issue, that there are certain things for research activity you require some equipments which cannot be attained in a corporate setup sometimes. So I would like to conclude that, although there are so many issues like commercialization, etc., but corporatization is not synonymous with commercialization. In spite of, working at an institution, I still feel that, corporatization is not synonymous with commercialization. It's just a polished approach of handling a patient, which sometimes is not very much done in many institutions. And it's just a question of a mindset and attitude. So the question was making it my cup of tea. So before I will switch over from my institution to a corporate setup, I will have to really, perhaps I will have to do an observership in a corporate hospital to see what exactly is the difference. And what I personally feel is that it's the difference of approach and mindset. The rest of the things remain the same. And with a difference of approach and mindset, you can have greater patient satisfaction with similar results. You can have 6/6 vision at two places, in a corporate setup as well as in any other hospital institution. In that institution, if the patient has not been explained about the achievement that the patient has, the patient may not be that satisfied. He will just feel that, okay, surgery has been done, it's fine, I'm okay, I'm going back. But the same thing, if he's there in a corporate hospital, it will be explained to the patient that you have achieved something big, and it's a big achievement, and you should feel very happy, so he will go very happy with that. So it's just a question of attitude and mindset before switching over from any institution to a corporate hospital. That's what I feel, and I would like to have the opinion of the panelists. Thank you.
That's a great talk, Dr. Rajesh. I just had to add on to that. I think that last point really nailed it, of patient expectation management. So post-operatively, I'm new into refractive practice, about 2 years down. I do post-op vision checks myself. So I don't let it go to the optometrist, because God knows what they will speak, and God knows what they'll show in the AR. I make sure that the patient reads 6/9, and once the patient is easily reading 6/9, then I push off to the next, because the patient will read 6/6. Yeah. They just want to reach 6/6 within 12 hours. That's the problem. So
absolutely.
Expectation management is the key.
Yeah. So if somebody is having even 6/6 partial, then if you immediately ask the patient to look at 6/6 and read, and if he's not able to read, then he will feel dissatisfied. So the first thing is start with a 6/9. If he reads 6/9 very well, you say, good, very good. And then you go ahead with 6/6. And if he reads, that's fine. If he reads partial, then you can say, maybe in a day or two, even that will get clear. So it's just the way you handle the patient that is actually the difference.
Just another point, having worked in a corporate hospital almost close to 8 years, I was heading the refractive surgery cornea there. I find that the one advantage, I think, is purely in terms of you not having to develop a practice for surgery, because that part is their responsibility. You focus on the technical part. So that is an advantage. Second is you have access to technology, which in my practice, I would need to take time to build it up and then buy that machine or access to technology. But because I shifted from a corporate hospital to private practice, and in terms of our partnership, we are still probably in the early stage, not good enough to probably afford top-of-the-line technology. But for a company where the money is not a matter, they would be able to adopt that technology faster. So if you like working with new technology, you want to see what is latest, that may be a reasonable practice option, provided you understand the limitations which you mentioned in terms of having to work with administrators, maybe some hospitals may be giving targets to doctors. Those are limitations. But if you like working with technology and you can balance that part out, I think it's a reasonable starting point.
Yeah, but the only issue is that, but they also expect a turnover from that. They also expect a, we have to balance the cost benefit. So sometimes even some corporate hospitals, what I have felt, I've seen in some places, they are taking time in getting new technologies or new things. But yes, it depends again of the level of turnover that is there. So, and plus the market survey that they are doing, that what's the need of the patient. That's very important. So if the patient comes with a demand of smile, and there are too many patients coming, like in a day you are getting 10 patients that I want to get smile done, and you're not having smile in your hospital, then immediately you will buy a smile machine, so that you don't lose out on patients. So that is very important. But that is not possible if somebody is doing a personal practice, because it takes time to generate that much of money. That is not possible immediately in an institution wherein you have to, there are certain procedures to get things. So we also got Smile quite long back, but then we had to start immediately. Smile was launched, so we started working. So it took 6 months time to get everything cleared. So now we're having it for quite long, but I mean, there are certain procedural hassles, and there are certain monetary hassles with individuals, and procedural hassles in institutions. But in a corporate hospital, if there are 10 patients coming every day for Smile and you're refusing, then in 15 days you will have a machine and you start working.